Since May of last year, Edmontonians have been waiting in pain because this government cannot manage the health system. Last May, the Royal Alexandra Hospital was told they were working too efficiently, performing too many hips and knees. So their funding for elective surgery was cut by 15%. To the same minister, given the budget increase, will the Royal Alec now be directed to work to their full capacity and finally start reducing the number of Albertans waiting in pain for hip and knee surgery?
The Honourable Minister.
Thank you, Mr. Speaker. I was at the Royal Alec just last week, and I was there the week before. And I was touring and learned a lot about how that hospital functions as part of my learning curve. And now that we have a fixed budget, and now that we know a little bit more about the predictable and stable funding, I'm sure we'll be able to address exactly those kind of issues. And I'm grateful for the honourable doctors and the honourable leaders of the opposition's question in that regard, because it will help us focus on what's important, our patients, and that's what we're doing.
The Honourable Leader.
Well, thank you, Mr. Speaker. A plan is what is needed, and this minister has yet to show he has a plan, other than to pile on more money. Are there enough staff? Are there enough staff to actually increase the number of hip and knee operations at the Alex? Staffing.
The Honourable Minister.
Mr. Speaker, staffing is an issue, and that's why on Dr. Duckett's blog today you will see a comment on how we're going to retain the maximum number of people possible, how we might possibly be even hiring more people to keep up with the demands for the services that Albertans expect out of the Alberta healthcare system. We are focused on a plan, exactly that will deliver the best performing publicly funded health system in Canada right here in Alberta, and we're going to get that done.
The Honourable Leader.
Well, what an interesting flip-flop in messaging from Dr. Duckett between this month and last. If the minister has a plan, he should have specific details.
Last month he was telling people in Cold Lake to go away.
If the minister has a plan, he should have specific details and outcomes. Can the minister tell Albertans how many more hip and knee surgeries the budget increase in Alberta Health Services will get for Albertans?
The Honourable Minister.
Mr. Speaker, that will depend partly on how quickly we can get on with activity-based funding, which addresses exactly that. And we'll know more by April 1st, quite clearly. We'll be having a meeting next week, which will bring together the nurses, the doctors, the Alberta Health Services, myself, the Honourable Member from Edmonton Meadowlark, and we're going to sit down and thrash through some of this stuff, including performance measures, which I suspect is partly where the Honourable Leader is going, and we'll get there.